Health provision varies around the world. Almost all wealthy nations provide universal health care to its citizens. Health provision is challenging due to the costs required, as well as various social, cultural, political, and economic conditions. There is a perception among many Americans that despite coverage, cost, and other problems in the healthcare system, the quality of healthcare in the United States is better than it is anywhere else in the world, even though it's the only industrialized country that does not have universal healthcare for all its citizens. There are programs for the elderly, military service families, the disabled, children, and some poor, through programs such as Medicare and Medicaid. But some 45 million Americans go uninsured each year, while another 25 million Americans go underinsured. However, the emergency services system has sometimes felt strained due to patients' misuse of emergency services. A number of definitions of healthcare quality have been put forward over the years. The U.S. Institute of Medicine's definition, which has grounded expert work in the United States and elsewhere, describes quality as the degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. To make an informed assessment about the quality care in one health system versus another, it is important to look at a wide range of indicators.
My name is William, and right now I'm being treated for anemia, which was discovered after I was hospitalized for a back injury. Lived in Connecticut. My father was a Navy man, so kind of grew up in Connecticut. Then moved back to Florida when he retired. I graduated from high school here in South Florida at Cooper City. Well, it all started when I broke my back. I was moving some furniture and fell backwards. Broke a few vertebrae in my back, was hospitalized, and as they were treating me, they discovered several other different ailments with me, blood pressure, high cholesterol, and many other things that I was never even aware of. Had I not broken my back, I don't know where I'd be right now. At first, I was very nervous. I was never really a person to go to a doctor. But now that I'm seeing doctors, it's really helped me quite a bit. Since I've been diagnosed, I've learned to change my lifestyle quite a bit with the foods that I eat, activities, and such. Mainly, it's my diet. And also learned to take care of myself a little better. And since I have been seeing my doctor, my primary doctor, regularly, I've been referred to specialists for other conditions, such as pain management, who's taught me different ways to cope with pain rather than just taking narcotics. To me, quality health care is the attention I get from the doctor, which is, I don't feel like just another patient. I'm treated, by my name. I'm greeted by my name. When I go to see the doctors, they know exactly why I'm there. And I feel comfortable. Like I said, I don't feel like just another number.
My name is Catherine. I have hidradenitis suppurativa, which is a form of acne. And it causes very painful bumps and lesions under the arms and different areas where the sweat glands are most active. I am a mother, I'm a grandmother, love my grandchildren to death. It's part of this process that I'm going through with the system is so that I can be a better grandmother and a better mother and a better person and be active with my grandchildren. I have suffered with this illness for a very long time, probably 20 years of my life. gone through a lot of changes, a lot of things I haven't been able to do, a lot of undiagnosed jobs that I've lost because of it. Just my own self-esteem wasn't good because of having to wear shirts with sleeves all the time, and it just, you know, wasn't me. And I just really was so glad when somebody stepped forward and was able to take care of this and diagnose me after so long, because it has just been a horrific thing, and I'm so glad that I have the doctors that I have. For me, I believe quality health care means that, of course, every American should have the right to get quality health care, but the ones of us that are getting it, I think it means exactly what I'm getting through this, which are professionals, really caring, concerned individuals and doctors and true professionals in their field. They deserve to be where they're at, and I, for one, am very grateful and very lucky that I have found a group of doctors like I have. And I hope that the healthcare system continues to be this way, because it is outstanding.
Mi nombre es Harold y la condición mía es, soy portador del VIH, definitivamente el SIDA. Primero que todo, a mí me dio neumonía y en el hospital, y después me dieron 4 úlceras en el estómago. Cuando me revisaron y todo eso, supieron los médicos que tenía VIH, y de ahí me puse grave, cada vez peor.
Yo cada rato lo llevaba al hospital, y en el hospital la última vez, antes de ir donde el doctor Pun, lo desahuciaron. A mí el doctor me dijo que no había nada que hacer, que ya él no tenía con qué pelear, las defensas estaban completamente bajitas, que no había nada que hacer. Y yo le contesté al doctor, pero usted me le va a seguir administrando la medicina, y él me dijo sí. Y yo le dije, bueno, Dios no ha dicho que no. Y sigamos. Cuando eso, la enfermera me llamó también y me dijo, él en cualquier momento le va a dar un paro cardíaco y él se va a quedar. Así es de que usted también tiene que estar decidida y no vaya a pedir de que lo vayan a dejar conectado. Precisamente en ese día él convulsionó. Y yo pensé que era lo último ya, porque pues ya me habían dicho que no había nada que hacer, y los movimientos que hace una persona cuando convulsiona parece que es que ya va a morir. Es horrible. En ese momento me fui a orar y a pedirle a Dios por él, y ya lo sacamos del hospital. Ya otra vez me le dieron salida, y fue cuando ya nos comunicaron con esta entidad donde lo está tratando ahora, y de ahí ya viene lo mejor de él.
Mi experiencia del doctor Pun ha sido muy buena. Le doy muchas gracias a esa entidad, al doctor, que es el que me tiene en esta condición que me encuentro ahora. La medicina que me estoy tomando me ha caído muy bien. Para mí, cuidado de calidad es el servicio que me han prestado a mí. Creo que es un servicio excelente. La forma como me atienden los médicos, enfermeras, toda esa gente que está empapada con la enfermedad que yo poseo, es lo mejor que me ha podido pasar, y gracias a Dios por el servicio tan bueno que ha sido, me encuentro en la condición que me encuentro ahora en este momento.
My name is Yvette, and I had colon cancer. I left Haiti when I was 18, and I always want to be a cosmetologist. So I went to school for it. I have my license, and also I'm a mother of 6, a grandmother of 9, and a great-grandmother of 1. You know, I had a customer, she died now, but she had cancer, she had colon cancer. When she come to do her hair, she always telling me, Yvette, have yourself checked. Many years later, I start having problems. I went to a clinic, and then the doctor referred me to another clinic to have the test done. So I had to wait for a year before they can send me an appointment. So when I went, I got myself ready for the test, and then when I went there, They said they couldn't do it because, you know, I don't live in Dade. So that day I was devastated. They look at me that I was nothing. I cried that day. And then I went back to the doctor. I told him that. He said, okay, don't worry about it. I'm going to give you an address to go to a clinic in Broward. So when I went to Broward, I was welcome. When I went to that clinic, I was welcome. I saw Dr. Vielo. I explained her my problem. And she said, don't worry about it. I'm going to send you for a test, for a colonoscopy test. So when I went for the test, they found 6 polyps. One of them had cancer. Oh boy, I thought I was going to die. That was horrible. It was bad for me and my family. And when I went the second time, the doctor said, you are very lucky. You don't have to go to chemo. And I have to say thank you to Broward Family Community Health Center. If it wasn't for them, I wasn't going to be here now. Quality health care means a lot to me, where people can take care of you, where you can go and feel equal. Like, you know, you don't have to be worried, you don't have to think, you know, you're not a big thing, they're not going to take care of you. I think it's a good thing. I think quality health care means a lot.
My name is Xiomara Barona. When I first time come to the Dr. Erica, it was because I have a cataract on my left eye, and she sent me to do the blood, and then she found out that I have a high blood pressure, high cholesterol, and very high diabetes. I have a brother, he died 4 years ago for the same kind of sickness. He didn't follow what the doctor told him, so he lived the life like he was in a good conditions. For that reason, the first thing he lost los dedos de los pies, his toes, on the legs. He got problem in the heart. They have to put some bulb for the vein, for the blood and fluid, because on the third time that the doctor do the surgery on his heart, he died. So I was sad when the doctor told me I was diabetic, because we saw him. So I said, no, this diabetes is not gonna win me. I'm gonna win diabetes. And I said, if I don't do what the doctor tell me to do, then I'm gonna be just like my brother. I'm gonna be dead. So I said, no, I'm gonna drink my medication. As soon as I drink my medication, I start doing my exercise. I walk 1 hour every day. I started lazy because I was fat, I was tired, and I said, no, today I'm not going. Today I'm going, and I'm gonna go today. And I get up from my bed, and before I go to my work, I go and I walk my hour. Quality healthcare means for me is to see my doctor, and that she was worried about my health. She was worried about the patient. When the first time I came, she was very mad on me. And when she found out that I was proving everything, she was very happy. She jumped, she kissed me, she hugged me. Never a doctor hugged me, never a doctor kissed me. I never see a doctor so happy the way the Dr. Erica was with me. And she said, Xiomara, don't stop, keep it up. Don't stop, keep it up. That's why I don't stop, I keep it up. I remember, every time I remember, I see her face in my mind, and I remember her word that, keep it up, don't stop.
Quality is personal attention,
respect,
Worry-free.
Quality is
buen servicio,
Dedicación.
competent staff,
Quality is supportive,
family atmosphere,
empathy.
Calidad es humanidad.
Y excelente atención.
Quality is
help.
Community health centers and their partners are making a difference in communities all across America. Drawing from years of experience on the front lines of healthcare, we see the results of our work every day, from healthier newborns to better health outcomes for adults with chronic illnesses. We understand the value of the patient's perspective and do our best to incorporate that in the care we provide. The board members, administrators, providers, nurses, and support staff continue to be committed to providing the highest level of quality. Joint Commission accreditation, NCQA medical home recognition, and utilization of a certified electronic health record system are catalysts that assist us in achieving our goal of quality care for all. As we continue to journey through the ever-changing healthcare environment and strive to provide the highest quality possible, we will always remember stories like those shared in this video, and we hope you will too.